here. Our funding at the NIH, I've been at the NIH for 20 years now, and our funding comes from the taxpayers of the United States through Congress, and we really appreciate the funding that we get, and we try to put it to the best use we can to take care of rare hereditary diseases like we've been hearing about here this afternoon. There is a lot more to be done, and I'd like to talk about one particular disease that we've worked on, and that serves as a kind of success story. Over the last 30 years, the field has identified over the genetic causes of over 6,000 hereditary diseases. We've heard about 3 of them here today. And the gene discovery is a great step forward in understanding what the underlying cause of the disease is and being able to diagnose the disease. But it starts us on a path that we've been hearing about already, back towards the patients to understand the underlying mechanism of the disease and to use that information to develop targeted treatment that's going to ultimately help the patients. The one other disease that I wanted to talk about here is a disease called spinal muscular atrophy, and it's a nice success story. I like to talk about it because just recently, about a year and a half ago, a treatment was approved for this disease, and there are more on the way. So it shows us a path that can be followed with many of the others. So spinal muscular atrophy is a severe hereditary disease of infancy. It's an autosomal recessive disease, which means that you inherit it, the patients inherit the problem from both parents. It's said to be the most common severe hereditary disease of infancy. About 1 in 10,000 babies are affected. Parents who are carrying this mutation, the frequency of people who are carrying this mutation is about 1 in 40. So here in this room, there are probably at least 1 or 2 of us who are carrying this mutation, who if we have a baby with somebody else who's carrying the mutation, the baby will be affected. So we're 1 or 2 people in this room are at risk of having children or grandchildren affected with this disease. It causes severe weakness early in life. The most common severe form of the disease, the babies are affected within the first year with weakness in their arms and legs, and the weakness also affects their breathing muscles. The weakness is caused by loss of motor neurons, so it's like a severe hereditary form of Lou Gehrig's disease, perhaps. There is the progressive weakness that makes it difficult for these babies to feed and to breathe, and they usually die from the disease within a year or 2 without aggressive support. The underlying cause of this disease, the gene that's mutated that is the cause of this disease, was identified about 22 years ago, and it was given the name the survival motor neuron gene, or the survival motor neuron protein that's encoded by this gene. And it's a loss of this SMN, survival motor neuron protein, that causes spinal muscular atrophy. Since the gene was discovered, the disease has been reproduced in a series of animal models, worms and fish and flies and mice. And the mice show the same kind of severe manifestations that the patients do. Well, Louise mentioned oligonucleotide treatment, and this is the kind of treatment which has been developed, which has been found to be effective in this disease. I should say that it's been clear from the animal studies, work done in our lab at the NIH and elsewhere around the world, has shown that you can rescue the disease in animals, in mice, by increasing SMN levels. For some years now, we've been able to treat this disease very nicely in mice, and if we had mice as patients, we'd be fine. But to make the transition from a treatment that's effective in mice to an effective treatment in patients takes a lot of work, but it has been successful here. So these oligonucleotides are short pieces of DNA, RNA, or DNA-RNA hybrids that target the transcript, the messenger RNA that's encoded by the mutant DNA in the gene, and it corrects for the mutation at the messenger RNA level so that the protein levels are increased. And oligonucleotides have now been shown to be effective as treatment in spinal muscular atrophy, as I'll say here, and in other diseases like muscular dystrophy, for example. The great step forward, what came from a treatment that was initiated based in part on work done at the NIH and NIH and funded investigators elsewhere by a biotech company in California called Ionis, company that used to be called ISIS but changed its name a few years ago. And a treatment that was picked up after the initial therapeutics development by Ionis by a larger company in Massachusetts called Biogen. The oligonucleotide that they developed targets the SMN messenger RNA. The drug is given the name nusinersen or Spinraza. And it's given by spinal tap into the spinal fluid 5 times in the first year and every 4 months after that. It was approved by the FDA in December on a fast track towards approval based on amazing effects of the treatment on the babies who are affected. Here's a news article that came out around the time the treatment was approved, and it shows a little boy in South Carolina who was nearly paralyzed at 5 weeks of age by this disease. Yep. And with the treatment, he has gotten stronger month by month by month, and he's now quite active. The graph on the right shows that the result of this treatment, when started early, that these patients who would get weaker and weaker and die instead become stronger month by month as they get older. If the treatment is started early enough, the disease can be completely blocked, and it has effects late in the course of the disease, although they're less, they're not as easy to document in this way. So another approach, in addition to the approved oligonucleotide nusinersen, is gene replacement therapy. And results here are equally dramatic. Only this time, the treatment's given intravenously, and just 1 dose of treatment, when given early in the first 6 months, can completely reverse the disease manifestations. This is work that was done at Ohio State Nationwide Children's Hospital in Columbus, and this drug, this gene replacement approach has been picked up. A company was founded at Avexis, and now Novartis is moving forward with therapeutics development in larger clinical trials. And finally, small molecules are under development and have shown promising, quite promising results in clinical trials. These small molecules, started by a biotech company in New Jersey called PTC, and by Novartis, and taken up by Roche, a multinational pharmaceutical company based in Basel, with Genentech in the United States. These small molecules work just the same as the oligonucleotides in correcting the defect in spinal muscular atrophy at the messenger RNA level. These drugs can be taken in pill form, and they distribute, they're taken up into the body and get into the nervous system at good levels and into the muscle. And just recently at a SMA meeting a few weeks ago in Dallas, Genentech and Roche presented their results, and it looks like these pills work just as well as the oligonucleotide that's given intrathecally. There are 3 trials in progress that document this. So in summary, treatment for SMA, it looks like at this stage that there's going to be similar benefit. There's remarkable benefit with oligonucleotide that's given into the spinal fluid, what we say intrathecally. There's also quite remarkable benefit with gene replacement, a one-and-done treatment given early in life intravenously, and now with small molecules that are under development by Roche and Novartis. There is sustained improvement that improves from month to month in these patients, with improvement from month to month in these patients, such that severely affected patients turn into patients who have a moderate deficit, and those who are more moderate, have more moderate manifestations turn into mildly affected patients. And if the treatment is given before the disease onset in the first few weeks or months of life, it can completely eliminate the disease. This is provides a strong rationale for newborn screening, as we heard about with PKU. And newborn screening was just approved by Secretary Azar of Health and Human Services, and it's been implemented in 4 states so far: Wisconsin, Missouri, Indiana, and Utah. And 5 other states have pilot projects in place. It was the last of the 35 drugs that have been recommended for newborn screening because of the remarkable benefit. Just in closing, I'd like to show here a patient with spinal muscular atrophy. Is a remarkable young woman, Audrey Winkelsauce from Florida, who is a graduate student with us at the NIH in a graduate program between the NIH and Oxford. She just presented her results on Monday at a meeting in England, and it was very well received. Earlier at the meeting in Dallas I mentioned. She is affected by spinal muscular atrophy. She has a moderate form of the disease, and she's working on spinal muscular atrophy to develop new and improved treatment in our lab. Here's some of the other trainees, students in our group. They're not all female, but only female showed up for the picture. Okay, thanks.